My name is Cindy Kesa. I'm a registered nurse. I'm doing an assignment for my nursing class, Pharmacology Learning Plan 4. My video is going to be on eczema. Eczema is a skin condition caused by increased vasodilation and generalized edema of the skin. The skin becomes dry to the touch, and as eczema develops, redness and swelling occurs. Scratching the area may cause an exacerbation, and it may extend to an exudative, scaling, and crusting phase. Blistering may be present as part of the inflammatory process. Atopic dermatitis is the most common cause of eczema. Atopic dermatitis is also known as allergic reaction to some pollutant. It could be related to a food allergy, pollutant in the air, or some other thing that causes your skin to inflame and turn red, and most often becomes itchy and scaly and dry. In chronic eczema, skin becomes thickened, leathery, and hyperpigmented from recurrent irritation and scratching. The location of eczema is related to the underlying cause. Most often, eczema is found in the bends of your arms and behind the knees where your knees bend. Forms of eczema include Pontholic eczema, which is a blistering eczema that develops quickly and normally is localized to the palms of your hands and the soles of the feet. Discoid eczema is characterized by coin-shaped lesions on the limbs. It can be classified as wet or dry and affects middle-aged to older people. It may last for only a short duration and not be a chronic disorder. Steatotic eczema affects the lower legs of older people, and it appears to be related to a deficiency of sebaceous secreting glands, which results in excessive dryness and scaling of the skin. It's more common in the winter months when there's less humidity and people are not outdoors as often. Varicose eczema, also known as stasis eczema, is an eczema of the legs and is related to chronic venous stasis. Seborrheic dermatitis, also known as cradle cap in infants, is an inflammatory response to a certain yeast. Topical medications are used to control the disorder. Some topicals that are used are emollients, which moisturize and lubricate the skin. Oily, occlusive ointments are used for dry, hyperkeratotic skin, while grease-based preparations are used for flaky, rough, excoriated skin, and erythematous inflamed skin benefits from the cooling effect of water-soluble creams. Cream should be applied in a downward stroke in the direction of hair growth to reduce friction and irritation that may trigger itching to the area. Topical corticosteroids, which are also known as anti-inflammatory medications, should be applied 30 minutes after the topical emollient. Ointment is preferred because it is more viscous and occlusive. Creams are used if the skin is moist and sore. Lotions are easy to apply and require less friction and are less likely to irritate the hair follicles if the skin is hairy, also less likely to cause itching to the area. Sprays are available and enable a minimal touch technique, which is helpful when the skin is sore. They're also useful if dexterity is a problem because it enables coverage of hard to reach areas such as your back and the lower limbs. Physicians need to be aware of the amount of cream to prescribe. They need to be aware of the amount of area that needs to be covered so that enough cream is prescribed for the length of time it's prescribed for. It's important for nurses to remember that the patients that are suffering from this disorder wear their treatment, so smell, feel, and potential staining of their clothing is crucial to compliance with their medication regimen. Thank you very much for watching.